The threat of legal action in the medical field is a major driver in cost. Increased medical malpractice, insurance over-testing, procedures done out of fear of legal action, out-of-control settlements. Do you favor medical tort reform to lower medical costs? Perhaps limit on the lawyer-patient settlement? Or do you believe we should continue the lawyer's Bill of Rights?
Well, I don't agree with the current plan. I don't agree with current plans to limit the ability of people who have been killed or catastrophically injured to be compensated for their loss. And I'll tell you why. Since 2000, there have been 3 studies when the Republicans were in control of Congress and when President Bush was in the White House, looking at the very issue you've talked about. The Congressional Budget Office, the General Accounting Office, the Institutes of Medicine all looked at this issue. They all concluded that at most, the cost of medical malpractice and defensive medicine represented less than 1.5% of our total health care costs. And they also concluded that even if you pass dramatic things like a $250,000 cap on quality of life damages, those savings never get passed on to medical consumers. And I'll give you a good example. When George Bush was president in Texas, they passed a $250,000 cap on quality of life damages, which, by the way, hurt most elderly people who don't have wages, stay-at-home moms who don't earn wages, and children who don't earn wages. So the cap I'm talking about penalizes seniors, stay-at-home moms, and children who've been injured severely or catastrophically. So what happened is Texas passed this bill that limited what you could recover, and a year later and 2 years later they went out and surveyed the doctors and hospitals, and not one of them had reduced their rates because of limiting liability. And so here's how I look at that. I look around this room, I trust the people in this room to decide what's fair more than I trust Congress or a bunch of legislators to decide what you should be entitled to if something wrong happens to you and your family. Because these are the same people sitting here today that go to the Clinton County Courthouse and serve on juries and decide whether something is fair or not. Whereas you've got people in Congress who know nothing about your case, know nothing about how it impacted you and your family, saying, nope, that's all you can get. Plus, let's look about it. Let's look at this issue from a personal standpoint in Iowa. Can you tell me the last time there was a runaway medical malpractice jury verdict here in Clinton County? See, that's the point. The only people who are harmed by a cap on damage are the people who've been most severely injured. It doesn't do anything to discourage frivolous lawsuits, because if you get above that number, you've got a legitimate claim. It's only the most severely injured who are affected by that. So I tend to believe in the 7th Amendment to the Constitution, which says that in jury trials, it's the people like this who get to make that decision, not some legislator.